The U.S. Department of Health and Human Services has released the 2020 federal poverty level numbers. Now, this was published in the Federal Register on January 17th, 2020, with a January 15th, 2020 effective date. Now, the federal poverty level, sometimes abbreviated as FPL, is established by the federal government as the minimum amount of gross income a family needs for basic survival: food, clothing, transportation, shelter, and other necessities. It does vary according to one's family size, and it is adjusted annually based on the Consumer Price Index. Now, it is used as an eligibility criteria for a number of community and federal programs, so we watch closely for it to be published every year, and that usually happens about the middle to late January. And like we said, Health and Human Services has made their use of the 2020 FPL chart effective as of January 15th. Other public benefits programs and other agencies may have a different effective date, so you're going to want to make sure to look into that for the specific program and eligibility you're considering. Also, keep in mind that certain programs might use the 2019 federal poverty level moving forward, even though we're physically in 2020. And one example of that is the Affordable Care Act's Marketplace. You may be using the 2019 annual income to determine your eligibility for 2020 coverage. So be careful to read the rules and guidelines of which FPL chart you are using for which program. Now, we do make it easier for you to navigate the 2020 federal poverty level chart, and in the description below, we link to our FPL Calculator. This is a tool powered and protected by My Coverage Plan, Inc. We share the link with you where you can enter gross income and family size, and it will calculate the 2020 federal poverty level for the family you are working with. Now, we also share in the description below the FPL chart if you want to look at the grid of the family size and income to make it a little bit easier, as it was published by the Department of Health and Human Services, and we also link to where it appeared in the Federal Register.